out as a falls prevention initiative, but it's actually evolved over time to look at the full continuum of aging from a bit of a falls prevention perspective. So we really have kind of tried to pivot away from falls prevention and move towards more holistic approach to healthy aging. Our three main themes include let's be active, let's be social, and let's be strong. So each one of the topics that we'll touch on today fall within one of these three themes. Our ultimate goal of Stay on Your Feet is to improve the quality of life of older adults by reducing the risk, rate, and severity of falls. And for our region, we cover Nipissing and Parry Sound, but the Northeast map is here. So a lot of what you hear today will be kind of like a bit of a summary of what you've heard from other presentations throughout the week. So we're going to share some resources as well as just little tips that we have that are related to healthy aging. Next slide, please. So the 5 things that we're going to touch on today is social isolation, medication management, nutrition, physical activity, and home hazards. So I'm going to cover the first 2, and then Taylor's going to take over and do the last 3. But Taylor, if I don't stop talking, please interrupt me. Next slide, please. Oh, so we have another poll here. So we have peppered quite a few polls throughout our presentation just to try to keep it a bit active or interactive, given we're Friday morning here. So if you could please respond to this poll. So what kind of transportation do you have access to? And you can select multiple options if you'd like. So if you have your own transportation, you have transportation through a family or friend, you have access to public transportation, or if you don't have access to transportation.
We're at 90%.
We're getting so close. Hey, we did it.
Yay.
Thank you, everybody. I'll end the poll here and we'll share the results.
You know, it's been an exciting week when we're pumped that we can get 100% participation. So everybody has access to their own transportation, which is fantastic. And then a few others also have transportation through friends and family, as well as public transportation. So that's great. Thank you, everybody. And I do recognize that depending on where everybody lives, access to public transportation might not be possible, but we are going to share a couple of other transportation options that exist within our communities. So next slide, please. So the first topic here that we're going to cover is social isolation. So sorry, I try to say that like 5 times fast. Social isolation is an important part of aging well. So staying social helps build relationships and improves your mental health. As older adults, keeping in touch with the important people in your life can help stave off loneliness and feelings of isolation that can lead to depression, as well as mental and physical decline. Sorry, excuse me. Engaging with others in online courses appears to foster a sense of belonging to a group, albeit virtual in that case, improve self-esteem, and help address isolation among older adults. So a lot of the presentations we've heard of this week, including Dr. Sullivan, first thing Monday, as well as Michelin a little bit later in the week, have talked a bit about social isolation. So this just kind of reiterates that piece that social isolation is a really important part of aging well and really helps with our mental and physical well-being. Next slide, please. So some things that we're doing here with Stay on Your Feet as a larger coalition and resources that we have available to folks related to social isolation includes this little, it's actually a printed resource that we've just copied here. So it's a printed resource that includes information on all of the virtual social programs that exist within our communities. So many of these you might have heard of throughout this week, including the Village. We've heard a lot from the Village, as well as Ava from the Alzheimer's Society we've heard of, and Leslie from East Parry Sound Community Support Services. So these are just some print resources that we have available that really summarize all of the things that folks have talked about through other presentations this week that we have available for anybody to use. So some include virtual recreation programs, or some of these are also kind of social call-in options. Next slide, please, Taylor. In addition to that, on the same resource, we have some information about support with technology. So we heard from Kasia from Cyber Seniors earlier this week as well. So this just again summarizes and highlights the information that's available within our community. Next slide, please. And then finally, this one is kind of impossible to read on the slide, but again, is another print resource that kind of goes along with that transportation question that we just asked. So it might not be as relevant to the folks in this group, but if you are talking to anybody who may be looking for support in transportation, we have this resource that is available that highlights all of the different publicly accessible transportation options within our communities, some of which again we've heard of from this week, including the Red Cross and again the community support services. So some of these are paid services that provide transportation to folks who might need a little bit of extra support. And then for folks living in First Nations communities, we also have quite a bit of information on the medical transportation services that exist through the health centers. Next slide, please. Thank you. So our next slide here is around medication management, which is going to be the next topic that we cover. So Kelsey, if I could get you to launch the medication poll. So this poll is, do you regularly review your medications with your healthcare provider or pharmacist? And my apologies for folks who are calling in over the phone. I know that having this little break for polling questions when you're on the phone isn't quite as interactive for you, but thank you for bearing with us. Oh, that's a good point. Thank you, Susan. Sorry, I can only see half your name here. Yes, Susan. That's a really good point for this poll. We might not get 100% participation just because if some folks don't take medication, they have no need to review their medication. So it's not relevant to those people. So that's a great point. Thank you for bringing that up. And feel free to not answer the poll if that's the case.
So on the poll here, we're at 81%.
So that's great. So every time you pick up medication is a high option, as well as every year. So that's fantastic. So we're just going to go through a little bit of information around medication and how this might affect healthy aging and falls prevention. So as everybody knows, falls aren't necessarily a normal part of aging. They are predictable and can be prevented. And some drug interactions around prescription medications and over-the-counter drugs can actually cause drowsiness and dizziness, as I'm sure many of us know when taking a look at the side effects on some of the medications we might be taking. And these can of course lead to falls, that drowsiness and dizziness. It's important to keep an updated list of prescriptions and over-the-counter medications with you at all times. This list could include the medication name, the amount taken, the time to be taken, the prescribing physician, and the reason for the medication. And try to have all of the prescriptions filled, like if you can, at the same pharmacy so that your records are all in the same place. And this will alert the pharmacist if there's any newly prescribed drugs that might cause an interaction with medications that you're already on. So that's some important reasons. So if your pharmacist takes a look at that every time a new prescription is provided to you or to them. But if not, just to consult with them every 6 to 12 months, just to make sure that there aren't any new interactions that you should be worried about that could increase the risk of a fall or any other harmful interactions. Next slide, please, Taylor. So something that we have that will help to have these conversations with either and or your pharmacist or your primary care provider is on the left here. Again, this is a printed resource that just goes through 5 questions to ask about your medications when you're talking to any of your care providers. So these questions can include things like, have any new medications been changed or added, and why? Are there any medications that you need to keep taking? Making sure that the proper use is known, and monitoring any negative effects, or how to monitor if the medication is working. And then, of course, if there's any follow-up needed, and if there's any interactions that might happen. So that's one resource we have to help kind of guide these conversations, every 6 to 12 months, discussing interactions with medications with your primary care provider. And then on the left, this is a little like paper bag that we have that we can give away to folks who might be interested to help clean out their medication cupboards, your medicine cabinets, that's the word. So it's basically kind of put in any medications that maybe have expired or that you're no longer needing anymore, that you have extra of. You can put them in the bag and then bring them back to any pharmacist, any local pharmacist, and they will dispose of them properly. And so this is important just to ensure that there's no expired or unused or unneeded medications lying around, especially another one of my portfolios at the health unit is enhanced harm reduction. So especially when it comes to like opioids or other substances that we definitely don't want to have lying around, it's really important. And thank you, that's another great point. Medications can also be brought to the hazardous waste depot. So depending on where you live in the North Bay area or the Parry Sound area, the hazardous waste depot can take back medications and the pharmacy takes them back free of charge. So thank you for that. And then next slide, I think, is another poll. This is just the fun true or false question. I don't know if fun's the right word, and then I'm going to turn it over to Taylor to take it away.
Thanks. So yeah, so if you'd like to answer, so like Sam said, it's just a true or false question. I'm wondering if skipping meals puts you at risk for a fall. So is that true or is that false? So we're at 72%. We're still at 72%. So Kelsey, we can probably show the results. Perfect. Okay. So 100% said it's true, and you guys are correct for that. I'm just going to. All right, so our next category that we're looking at is nutrition. So nutrition is a modifiable risk factor that can increase your fall risk due to maybe experiencing weakness, weight loss, or inadequate food intake, or fluid or food intake. So like that poll just said, so food plays a key role in preventing falls. And so if you skip a meal, or if you're not drinking enough water or fluid or liquid, it can make people feel dizzy or lightheaded, which can result in a fall. So a common side effect from feeling dehydration is dizziness, and it can potentially lead to a fall. So as we age, our sense of thirst declines, and therefore we need to drink more regularly, whether we feel thirsty or not. So you may not feel like you're thirsty, but you should continue to drink fluids. So the amount of fluids that you should be drinking every day, they used to say 9 cups for women and 12 cups for men, but now they're saying it depends on your health condition, your medication, your exercise, and also the climate. So having those conversations with your doctor, or your primary healthcare provider about that is really important. And these liquids can include anything from water, milk, coffee, tea, fruit juices, or soups. Any of those can be included in keeping you hydrated. So just some resources that are available that are helpful. So Canada's Food Guide, a couple years ago, they kind of redid it. It's a great resource to help you plan your meals. They have great graphics to show how your meal should look on your plate. On their website, they go through, you can also request the printouts of them to be mailed to you through their website, or by calling Samurai, we can help you get these resources as well. But they focus on, this new food guide focuses on your eating habits, cooking more often, eating with others, and making water your drink of choice. I know during the pandemic, it's been hard to eat with others, but I find that people have been very creative in using platforms like this that we're using today, Zoom, to have those opportunities to eat together. But now that some restrictions have have lessened, it allows us to. A couple of years ago, also, this Stay on Your Feet. They asked older adults as well as service providers why older adults in rural areas or rural communities in our districts might not eat so well. So some of the reasons that were provided were limited finances, lack of mobility or transportation, living alone, or lack of services or awareness of these services. And I believe it was yesterday on Michelin's press session in the morning, she asked in a poll about barriers to access, and a lot of people said they didn't have barriers, but some people said they just didn't know about the services. So it's kind of similar to what they found in their research a couple years ago through the Stay on Your Feet. So from this information, as well as information obtained through focus groups that were done with older adults, we created inventories of nutrition programs and services for rural communities. So we have these inventories for East Parry Sound, West Parry Sound, and Mattawa. We don't have any yet for Nipissing, but if you live in one of those rural communities, please feel free to contact us at the Health Unit. We can get you those inventories. They do include information on dietetic services, local food banks, Meals on Wheels, and community gardens. Also, our website, our Health Unit website, these resources can be found there, as well as on our Stay on Your Feet regional group. We have a website. These websites can be found on our last slide. They have different blog posts about tips on eating on a budget or cooking for 1 or 2 people. So those are also great, and that's great information for you as well. So we'll launch our next poll. It's about physical activity. So we're just asking, how many minutes of physical activity do you participate in each week? So let's think about the last 7 days, about how many minutes of physical activity did you participate in? All right, we're at 70%. Oh, 80%. We'll just give it a few more seconds. All right, let's see the results. Oh, that's great. So about 75% of the people that participated, they said that they're getting the last 7 days over 90 minutes. So that's incredible. That's great. And even the lowest amount that people reported were 40 to 60 minutes. So that's so great to hear. All right, so according to CSEP, which is the Canadian Society of Exercise Physiology, older adults should accumulate at least 150 minutes of moderate to vigorous intensity aerobic activity per week. And this activity should be done in bouts of 10 minutes or more in order to achieve health benefits. So aerobic activity, that's when you're continuously moving and it makes you feel a little bit warmer and you're starting to breathe a little bit heavier. So this can be just going for a walk at a faster pace, or maybe even shoveling the snow that we got today. Older adults should also perform resistance exercise at least 2 days per week. And so this is for example, strengthening activities like lifting weights or participating in maybe a yoga class. And it just keeps our muscles and bones strong and prevents bone loss. Some health benefits from being active may include improving balance, reducing falls and injuries, staying independent longer, and preventing some chronic diseases. So last year, I believe it was, they released the Canadian 24-hour movement guidelines for older adults. And it suggests that replacing sedentary behaviors with physical activity, they encourage that. They encourage performing a variety types and intensities of physical activity. So going for a walk and then maybe doing something that is a little bit more, maybe going for a quicker walk. As well as the importance of getting 7 to 8 hours of good quality sleep, and how important that is to see the health benefits. So I know in the past year and a half, it may have been hard to become active or stay active, as some of our programs may have been on hold. But our Stay on Your Feet coalition came up with these kind of similar to the social isolation ones, but for physical activity and inventory. So we have an inventory of online. So this shows some of the ones through VON. They do through Cogeco, as well as I believe on YouTube, the Alzheimer's Society, as well as some YouTube or from Soups to Tomatoes, which is a USB that we can provide you through the health unit that you can put in your computer or into your TV to do that if you don't maybe have access to the internet or know someone that doesn't have access to the internet. All right. So, and then we have a list of different providers that host free in-person exercises. Some of these may be on hold, some of them are going right now. So for example, I know Canada College is providing with the VON 2 times a week exercise classes, as well as in East Perry Sound, Leslie has exercise classes as well. So that is great. And in your welcome bags, I believe that they were included, the inventories. If you didn't get an inventory in your welcome bag or didn't receive a welcome bag for this session or for this symposium, please let us know. The information is also on our website, or by calling Samurai, we can get you connected with the resources. So we'll go to our last poll now. So this one's about home hazards. So where do you feel there are the most tripping or falling hazards in your home? So please feel free to vote. All right, we're at 62%. 75, we're getting up there. All right, I think we can check out what the results show. So 50% of people said in your living room or your family room, about 33% outside in the garage, and then 1% said in the bedroom. Right, so let's go into this topic. So individuals who have experienced a fall in the past are at greater risk of falling again. The majority of falls occur in or around our home, with many different contributing environmental factors. So it's important that we identify, we remove, and we report any hazards in or around our home in order to prevent a fall from happening or from happening again. So it's important that we keep all walkways, ramps, stairs, all clear of clutter, and we remove any wet leaves, we have snow and ice that we had today, and ensure that there's adequate lighting in areas so that people can see any hazards that could happen. It's also important that we keep emergency phone numbers beside your phone. So if you have a landline or maybe in your phone, just so that we can, if anything's needed, you're able to get to that emergency list right away. And we also ask that you be sure to speak to your primary care provider if you have had or are concerned about falling. So Stay on Your Feet has created a home and safety checklist. So it walks you through each and every room inside your house as well as outside of your house in order to help you identify any potential hazards that you may have. So this can be found on our website. Also, if you'd like a print copy, we can provide that to you as well. But it's a great way just to kind of go through and walk through your room with the checklist and see what might need to be done in order to keep you more safe at home. All right, so that's all that we had today. Our contact information is here on our last slide. Feel free to give us a call at any time or send us an email. Also at the bottom, you can see the two websites. So our local health unit website has a bunch of information. Some of you may have gone there already to register for this session or for the symposium, as well as the website at the bottom, the stayonyourfeet.ca, has a lot of great resources and blog posts that are created by all of the health units in the Northeast that are part of Stay on Your Feet. So if anyone has any questions or comments, please feel free to either type it in the chat or you can put your hand up and Kelsey can unmute you.
And as Taylor said, we have all of these available in print, and so we're happy to send you anything that you might have saw that you would like to receive. We can mail them out, whatever is easiest.
Got a nice comment in chat here. It says, thank you, Taylor and Sam and your team for this concise and informative presentation leading to proactive behaviors and habits. Thanks, Charlotte.
Oh, thank you so much, Charlotte.
Yeah, we also just want to thank everyone for coming and even just participating in all of the sessions this week. It's been a great week.
Yes, thank you all so much. I don't see any other questions coming through, but we'll be here for another minute or two if anybody has any. And if not, thank you all so much and have a great day.
Enjoy your day, everyone.